How many people here work with people who are involved in a sport or physical activity? Pretty much everybody. So as you were going to do sports massage on them, there are different levels of sports massage, different ways that one would approach this area. If somebody were getting ready to go into a particular event or a game or activity, if it's just within a few hours or even a few days, you would do less and less work to try to help this person. Your job basically is to stay fairly minimal and just work the other muscles that are going to allow the proper movements here. If you're working with somebody long term, let's say they've got an event coming up in April or something a few months down the road, and you're working with them consistently, then you can work a little bit less conservatively and try doing some different things to see if you can improve movements in the knee and in the hip and ankle. But as you get closer and closer to an event, you want to do fewer things. So let's get you guys up on your feet. One of the first places that you're going to have things going awry for you being on one foot is going to be in the knee. Does anybody kind of feel how that's happening? All right, so when we said we need to know what the person is actually planning to do with their knees, with their body, that might involve basic movements like running, where they're landing on one foot. And in such a case like that, you're going to have to balance between the hip musculature and the ankle musculature in the foot. They may be lunging, so if somebody's throwing, they may be getting into a lunge position. So you would want to make sure that your work kind of specifies what their activity is going to be doing. If they were doing something like a kick, either like this or out to the side, those would also kind of give you guys different jobs to do as a sports massage therapist. So, but one thing that they all seem to have in common, and jumping and all the other pushing and pulling and squatting, is that the feet are in contact with the ground. So as sports massage folks, we're going to really focus on making sure that the ankle and that the foot are doing their jobs, or able to do their jobs. So the way that the ankle, the arch system in the foot, and the hip joint is probably the main thing that causes knee troubles that I see. It's just whatever has happened with that particular body. If, for example, the person pronates badly, if you have that, then now the knee is going one direction and the foot is going another direction. So one thing you would want to look at in something like this is noticing that the femur has medially rotated and that the two bones down here have also medially rotated. And so as massage therapists, one thing that they would want to do just as clients is get stronger in the lateral rotators of the hip and making sure that all the musculature down here is able to do its job. And in this particular circumstance, the ones that help supinate the foot are going to be more, they would probably need to kind of activate those more. But as a massage therapist, you could go to the muscles that might be a little bit too short. So in this case, things that medially rotate the femur, like up here in the adductors and out here in the hip. And then if you can look at what's going on here as well, the lateral muscles here on the leg might be a little bit too short, and they could use some help kind of reestablishing that movement. All right. Well, thank you guys for coming tonight, and hope to see some of you in class. And if you have any questions, don't hesitate to call.